Hello friends, I am just going to show you how a short video demonstration of how you can use the MTA Carrier, which has been custom designed by me. There are two sizes available. This particular one is the small size, and as you can see it has two components. This one is the piston and this right here is the cannula. The piston fits inside the cannula and slightly juts out, as you can see here, so that it delivers the MTA material outside into the canal space or in the area of perforation. There is also an adjustable stopper over here which you can move according to the working length when you are delivering the MTA inside open apex cases. So first thing, we will deliver a little bit of the MTA material on our glass slab. Always keep some extra material handy just in case you need to add it later. You also take a couple of drops of saline. So we have one drop here and one drop on the side. We will slowly start incorporating the liquid inside the powder drop by drop. As you can see, the powder is now getting slightly wet. You can add a couple of more drops of liquid here, just so that the entire material starts getting wet. You want to have a wet sand type consistency for the MTA, which is what you can see over here. Now in case I need to add more material, I can add more powder or more liquid from right here. We'll just wait for this material to hydrate slightly. If you feel the material is too wet, you can take a sterile gauze and just dab on it lightly to soak out the excess amount of moisture. We will now take our carrier, just retract the piston a bit and start tapping on the MTA material, which will allow the material to get loaded into the carrier. Any excess material that's there at the tip of the carrier can be wiped out with a gauze, and now we are ready for the material to be delivered at the location. To deliver the material, you just need to press this end of the piston, and you will be able to see now that as I keep pressing the piston, the MTA material gets delivered, and that is one increment of MTA. If you want to deliver the second increment, just repeat the same process again. Pull the piston back, start loading the material by tapping on it. Press the piston back into its original location, and you have a second increment of MTA. Once the MTA is delivered to the desired site, especially in open apex cases, you can use something like this, which is a self-locking tweezer with a paper point, or you can use the same self-locking tweezer with a gutta percha point as a plugger to pack the material to the desired location. Alternately, you can also use metal pluggers to pack the MTA. A very important step after using the carrier is also to clean it well so that it can be used multiple times. And the easiest way to do this is just place some water in a dampened dish and press the piston multiple times. You will be able to see a very small whitish powder that's delivered out from along the sides. Once that is done, you can just clean the carrier with cold sterilizing solution, put it in an autoclave pouch, and it can be autoclaved multiple times. I have been using this carrier for delivering MTA in perforation repair cases, open apex cases since the past 12 years successfully, and I have also published an article on the same. I hope this video was useful for you and it will be helpful for you in your clinical practice while mixing, manipulating and delivering MTA to the desired site. Thank you.